Welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This new series for 2021 is being done in partnership with BayCare's Winter Haven Hospital to give you, the community, an opportunity to learn more about our local physicians, both personally and professionally, and to learn about the important services and programs that Winter Haven Hospital provides to keep our community healthy and thriving. On this episode, we are excited to welcome Dr. Ashley Falk. Dr. Falk is board certified in family medicine and serves as a core faculty physician for the Florida State University College of Medicine and the Winter Haven Hospital Family Medicine Residency Program at BayCare. Welcome to the show, Dr. Falk.
Oh, thank you for having me, Katie.
So we like to start these interviews with giving our viewers an opportunity to learn a little bit more about you personally. So share a little bit about your background, why you decided to go into medicine.
Sure. Well, Katie, I'm originally from Minnesota. That's where I grew up and actually met my husband there in middle school. I went to college out on the East Coast, but went back to Minnesota for medical school. And then I joined the United States Air Force and had the opportunity to serve as a physician in the Air Force for a number of years. I went and did residency training at the University of Nebraska in Nebraska, obviously. And I got into teaching partway through my career with the Air Force. So I taught in one of their medical training facilities in one of their residency programs. And then as I transitioned to civilian life, I had the opportunity to join the faculty of the University of Nebraska Medical Center. And I taught there in their family medicine residency, practicing full scope family medicine. So taking care of patients of all ages and at different stages of their health. I really got into medicine because I had an illness as a child, and I had the opportunity to see how wonderful the physicians were, how wonderful the care team was taking care of me and taking care of my family as well through it. And again, with a love of science, life just led me in that direction. Our family, we moved here to Florida a number of years ago, and I was in private practice for some time. And then my husband had the opportunity to start this residency program, which is a program where we take medical students who've graduated and they're physicians, and then they spend 3 years training with us, learning to practice as full scope physicians. So again, to get back into academia, I came here and obviously joined the faculty with the FSU BayCare program. We live here in Winter Haven, absolutely adore it, fantastic community, and are raising our 3 children here as well.
Well, that's wonderful. We are so blessed to have your family as Winter Haven residents, and really the medical residency program is so beneficial to our community for so many reasons. But one of the great benefits that comes from it was the creation of the Family Medical Center. So can you tell us a little bit about that and how that ties into the residency program?
Oh, sure, Katie. So our Family Health Center offers a wide variety of services, from just preventative or well care visits on an annual basis to sick visits when someone's suffering from a sinus infection or a gastrointestinal illness. We also do chronic disease management. So for our patients with diabetes or hypertension or asthma, we are well skilled in caring for those conditions. We also offer prenatal visits and OB care and postpartum care as well. And then we have some unique components to our program, in that not only do we have very experienced faculty physicians, but we also have a clinical pharmacist and a licensed psychologist on our faculty. So we can also help to evaluate and treat basic mental health conditions as well. And we have a sports medicine physician who can help with the treatment of musculoskeletal conditions. So again, we really aim to provide a medical home for our patients and provide the highest level of evidence-based care for them and their families.
For our viewers that may not be aware, this is filling such an important need in the Polk County community. I think
people just take for granted if they're lucky enough to have a medical home or they have a primary care physician that they see on a regular basis. But there is a large population of the community that needed that medical home. And so the benefit of being able to have this center open in conjunction with being able to help show what will end up being about 18 medical residents at full build out of the program,
Yes.
and allow them to learn and grow and hopefully fall in love with Polk County so they stay in Polk County. It's just
Absolutely.
filling such an amazing need in our community. So it's just so needed and important and vital to the future health of our community.
Absolutely.
So you mentioned that you really are soup to nuts in terms of what you are able to do for your patients. What age range do you serve at the center?
So the family medicine as a profession and specialty, we really serve ages from birth all the way to 99 plus. Some people will say cradle to grave or conception to resurrection. But that's one of the unique aspects of family medicine. And truly one of the things I enjoy the most is that what we call generational care. So I might see a 2-week-old for, just a well check, and then later see that 2-week-old's great grandmother for care of her diabetes. So again, we really get to know our patients and their families from, like I said, birth all the way through life.
That's amazing. And being able to establish and have that medical history. And there are, obviously there are residents that are going through the program, but there are more permanent physicians like yourself who are involved in the family medical center as well.
Absolutely. I tell people when you look at a residency program, it's almost like you're getting 2 physicians for one. You're getting a resident who is fresh out of medical school with some of, the most up-to-date and most current knowledge base. And then you're also getting, as I like to say, a little bit more seasoned, I won't say older, but seasoned provider. And we are providing care in a team environment where we're there to help and instruct them and provide them with some guidance. But again, you're going to have both of us working together.
So can you explain to our viewers what you mean when you say family-centered maternity care?
Sure. So family-centered maternity care is really an approach that really aims to deliver that best maternity care by focusing on the mother, on the baby, and the family as a whole. We really know that each pregnancy is a very unique experience for for every woman. And so what we're doing is by really centering our care around each woman and her family, we really aim to just individualize our approach to their care, creating those excellent relationships, and then also, incorporating any extra care that might be needed through our perinatologists, who would be our specialists when we have complications during pregnancy, or other specialties that we might need if there were something that was a little abnormal. We really see childbirth not as an illness, but as wellness. And so it's a very different approach than we might see in other settings. And I think one of the nice things about having this in Winter Haven is it provides all of our residents with lots of different options for when it comes time to make an addition to the family.
One of the things that was perfect timing to when the Family Medical Center opened is we actually had a wave of OBGYNs kind of retire around the same time that you guys opened. And that is what is so fantastic about that wraparound service that you provide, is that it really amplifies the number of physicians in our community that can help expectant mothers. And just like you said, I mean, hopefully no one looks at pregnancy that way. Everybody should look at pregnancy as just such a wonderful part and journey, and it can have challenges.
Absolutely.
Yes. As someone who has had 2 at Winter Haven Hospital and just had wonderful care at the facility, it's just top notch, the care that you get through Winter Haven Hospital. hospital and on your maternity journey and the actual act of giving birth as well. Just have been so impressed with the care that we've been able to get.
Absolutely.
So
Absolutely.
why is prenatal care so important for the patient?
Yeah. Well, prenatal care has been shown time and time again to improve the outcomes for both mothers and babies. Prenatal care involves, getting a good history from a patient, doing the appropriate screening that's needed for pregnancy, monitoring baby's growth during this critical time, and taking care of mother as a whole. And, evaluating to see if any of the conditions that are, a little bit more specific to pregnancy do evolve. And then if they do, incorporating a team-based model where we have our specialists involved as well. So that prenatal care, like I said, it's so important for healthy mothers and healthy babies.
I've noticed going through these interviews with the Ask Their Doctor series that BayCare has really taken a team-based approach to the health of their patients. And I think you outlined another reason how they do it with female care, women's health as well, when
Mhm.
it comes to this.
Absolutely.
What level of postpartum care can a patient receive after they have delivered their baby?
Yeah, depending on the nature of a patient's pregnancy and delivery, the timing of their postpartum care may vary, but generally we'll see patients back not only with their baby at, after discharge, but also for a 3 week and then usually a 6 week postpartum check. And part of that is just making sure that we're taking care of both the physical and emotional health of the new mother. And this can entail things from, are we doing okay with pain control? Do we need to talk about further contraceptive care? Are we struggling with breastfeeding or other newborn care? And then, we'll also make sure that we're evaluating for things like, development of postpartum depression. So again, it's very important timing, even that postpartum period, to really make sure that we're watching our moms closely and helping them as much as we can with that transition.
Our viewers that might not be as familiar with postpartum depression, and I
Mhm.
think it's been exciting as a woman to see it talked about a lot more. I think it was,
Absolutely.
something that just was, well, you're just tired. You heard that a lot. Well, you're just tired. Of course, you have a newborn and all of that sort of thing. But as if a viewer is a parent or
Mhm.
a husband or a friend of someone who has just had a baby, what can postpartum depression look like, and what are the methods that you use to evaluate the patient?
Sure. Yeah, that's an excellent and, like you mentioned, extremely important question. Um, so we know, like you said, childbirth and pregnancy and having a newborn comes with a lot of stress, and it can be a wide range of emotions too, from absolute happiness and joy to, unfortunately, profound sadness. And we do know that about 80% of women do experience some level of what we call the baby blues. And that typically occurs in those first days up to maybe 2 weeks after delivery, where someone will feel, very tearful, very worrisome, anxious, irritable. And we think that's related to some of those hormonal changes that occur. But what we do want to make sure that we don't miss, and we don't want women, suffering in silence, is postpartum depression. And that is a lot of the same symptoms that we'd have with the baby blues, but it's more prolonged, it's more severe. It starts to impact somebody's ability to enjoy life, to function on a day-to-day basis. Even simple things like getting out of bed or providing care for their infant can become extremely difficult. And again, I think one of the unique things about this family-centered care is that we really focus on that, and then incorporating other support family members in supporting our woman through that. We also have a licensed psychologist who we can pull into our visits to help if any therapy is needed. And then again, if there were medications or anything else that was needed, we're fully able to help mothers along in that manner too.
So, if a woman isn't quite in that stage of life where they're ready to have kids or they're done having kids, what sort of well woman visits or preventative care would you recommend for a woman?
Sure, sure. I typically recommend a yearly wellness visit with your physician, regardless of age or timing in life. And that visit really is meant to review your past medical history, review your family history, which can be very critical to determining what is appropriate screening and treatments for you, and then get an update on how your health or your health habits may have changed over the last year. And then we also spend some time doing some more directed screening, things like laboratories, such as looking for thyroid diseases, anemia, cholesterol issues, screening for diabetes. And then for women in particular, we want to make sure that we're doing adequate screening for cervical cancer through pap smears, breast cancer through mammograms. And then as we get a little bit older, colorectal cancer or colon cancer. And there's some different modalities to screen for that. And then osteoporosis, which is one that we often forget about. And then making recommendations regarding keeping somebody in good health over the years. How do we maintain good heart health? How do we maintain good bone health? And kind of taking a team-based approach with our patients as to what modifications they think that they can make to their health lifestyle.
Well, Dr. Falk, thank you so much for your willingness to take time out of your busy schedule to come on the show today, and for the immense service that you are providing to our community.
Oh, Katie, it's been such a pleasure. Thank you.